It's a pleasure to have you join us on another episode of 360 Health. I am Ogechukwu Ukekwe. The World Health Organization (WHO) says the global childhood immunization coverage stalled in 2023. In a report, the organization said the low coverage have left 2.7 million additional children on and under vaccinated. The WHO used vaccination against diphtheria and tetanus in 2023 as a key maker for the global immunization coverage. The organization said the number of children who received 3 doses of the DTP vaccine stood at 84%. It added that the number of children who did not receive a single dose of the vaccine increased from 13.9 million in 2022 to 14.5 million in 2023. The WHO said the data underscores the need for ongoing catch-up recovery and system-strengthening efforts. The unique research project in Nigeria is harnessing the power of young people and local knowledge to tackle some of the country's biggest health challenges. Led by the Nigerian Institute of Medical Research, the initiative is tapping into the infectious energy of Afrobeat to spread awareness about HIV testing, HPV vaccination, hepatitis B prevention, and hypertension with stroke. The project leverages the success of previous initiative, iTest, which dramatically increased access to HIV self-testing kits. Speaking during the closing ceremony of the 21 days bootcamp for these youth, the Director of Research at NIMR, Olivia Ezechi, explained that they realized that the youth have the energy and innovation to tackle other health issues. Recognizing the potentials of young Nigerians, the researcher designed a program that specifically focused on the ideas and solutions. We'll take a short break and we'll be right back. Welcome back. An ovarian cyst is a fluid-filled sac that forms on or inside the ovary. Most ovarian cysts are warm and resolve on their own without treatment. However, they can sometimes cause pain or other symptoms, especially if they rupture or become large. Monitoring through ultrasound and symptom management are common approaches. Treatment may involve medication or, in some cases, surgery to remove the yeast. Regular follow-up with healthcare provider is important to monitor changes and ensure appropriate management. Well, joining me on the program to discuss further is public health practitioner Dr. Adejoke Adepoju. Thank you for joining me on the program, Doctor. Can you explain what ovarian cyst is and the types of ovarian cysts and how they differ?
Okay, so before I tell us what ovarian cysts are, I would like to just give an overview of what ovaries are.
Okay.
So ovaries are 2 small glands located on either side of the woman's uterus, and they contain the eggs that are released monthly during ovulation and also produce the hormones that are necessary for a woman's reproductive function. So ovarian cysts are fluid-filled sacs that develop either on or within the ovaries. In most cases, cysts are harmless and would even resolve on their own without any medical intervention, while on some occasions, there will be a need for treatments. They most times are benign, and in some other cases, they may be cancerous. And in these regards, they would have to be treated aggressively. So basically, there are 2 types of ovarian cysts. We have the functional cysts and the pathological cysts. The functional cysts are the most common, and they usually develop as part of the menstrual processes that happen during the menstrual cycle. Usually they are harmless and short-lived. Examples of these are the follicular cyst and the corpus luteum cyst that happens during pregnancy. On the other hand, the pathological ovarian cysts usually occur as a result of abnormal cell growth, and these sometimes can be benign or cancerous. Examples include the endometriomas, the dermoid cyst, and the cystadenomas. The dermoid cysts are occur when skin structure grow and get trapped in places that they are not supposed to be during fetal development, and most times they grow even throughout the reproductive years. So when they are found in or on the ovaries, they are called dermoid ovarian cysts, while endometrioma is the kind of endometriosis that happen around or on the ovary. In this case, the cyst is usually filled with blood, and when this happens, it is called endometrioma cyst. So basically, these are the types of the ovarian cysts that we have.
Okay, so what would you say are the how can ovarian cysts be diagnosed, and what would you say are the early symptoms that one should look out for before seeking medical attention?
Okay, so most cysts actually are asymptomatic and may even go undiagnosed. So that is why it is good to always present early in the hospitals when you have symptoms that could point towards ovarian cysts. Some of them are picked on as incidental findings during routine pelvic examination or pelvic ultrasound. However, symptoms include pelvic pain, bloating, irregular periods, bowel obstructions, nausea, vomiting, weight loss also, and even abnormal uterine bleeding. So when anybody has any of these symptoms, it could be a pointer to the presence of an ovarian cyst. But overall, a pelvic scan together with findings of the pelvic examination will give the diagnosis of ovarian cyst.
Can you tell us the treatment options for ovarian cysts?
Okay, the treatments depend on the type and size of the ovarian cyst. And like I said earlier, that most cases of ovarian cysts are actually functional and so may even resolve on their own. But when there are needs to treat, the treatment modalities vary. The first thing is watchful waiting. So most times we just want to observe patients that have ovarian cysts. So if it's a functional type, it could resolve on its own, and a follow-up visit, let's say a follow-up pelvic scan in about a month after presentation, might just be necessary to see the progression of the cyst. And at this point, if it's functional and just simple, we expect it to have completely resolved. There might be a need to give analgesics just because pelvic pain is a common symptom of ovarian cyst. So an analgesic would be necessary to alleviate the pain that comes with it. And on some other occasions, there might be the need to prescribe birth control pills. So what birth control pills does in this particular scenario is that it inhibits ovulation. And since most cases of ovarian cysts happen around ovulation or happen as a result of the normal menstrual cycle, so when the ovulation process is inhibited, there is every likelihood that a recurrence of ovarian cysts would be inhibited as well, would be stopped. And if the ovarian cyst is actually found to be persistent or even pathological, then a surgical procedure will be necessary. Surgical procedures may involve laparoscopy or an open surgery. In the event of the laparoscopy, just a tiny incision is made on the patient's abdomen, and with the use of a device, the cyst is removed. While in open surgery, there is an open surgery, and the cyst is actually excised from the person. So those are the various treatment modalities that we have for patients having ovarian cysts. But basically, like I said, watchful waiting, observe to see if the cyst will resolve on their own, and alleviate the pain with the use of analgesics.
So can ovarian cysts affect future fertility in women?
Well, this depends on the type of cyst. Like, as we all know that functional cysts are the most common. So in the case of functional cysts, they are not likely to affect fertility. However, if the cysts are complex, they are capable of distorting the ovary and in turn interfere with ovulation, which is very necessary infertility. So when the cyst is complex, ovulation is affected, then it could affect fertility on the long run. Also, for pathological cysts, because they're actually abnormal growths where they are not supposed to be, fertility can be hindered when these occur. An example of pathological cysts, like I mentioned earlier, is the endometrioma. So when the cells that are supposed to be in the uterus are found elsewhere, for instance, now found on the ovary or in the ovary, definitely it's going to affect the normal function of the ovary, affecting ovulation and in turn making fertility an issue. Also, we have a case we call PCOS, polycystic ovarian syndrome. This is a case whereby there are so many cysts around the ovary. So it could cause problems with ovulation, it could cause irregular menstruation. There is also an associated other associated symptoms like excessive hair growth and even acne. So when this is in place, fertility can be affected in a great way. Otherwise, if it's functional, there might be no affectation of fertility.
So is there a way ovarian cysts can be prevented? Can you explain to us if there's a way it can be prevented?
Well, basically, there is no particular way ovarian cysts can be prevented because some of these things just happen by nature. For like I said that when I was telling us about what happens during ovarian cysts, most ovarian cysts happen as a result of the processes that happen during the menstrual cycle. So as long as the menstrual cycle is in place, as long as ovulation takes place, ovarian cysts can occur. And since they are not so serious, since they are basically harmless, it might not be a big deal. But the main thing is that healthy lifestyle, healthy life practices will be very, very important in stalling maybe the occurrence or even the recurrence of ovarian cysts. For instance, healthy eating has been known as a rule of thumb to prevent the occurrence of so many kinds of diseases. So eating foods that are so rich in fruits, vegetables, whole grains, basically natural and normal foods would help to prevent many, many health conditions, of which ovarian cyst is one of them. And on the other hand, practices like eating junks, a lot of processed foods, being exposed to chemicals and toxins can actually make the occurrence of ovarian cysts to be commoner. But basically, there is no one thing that can be done or that shouldn't be done to prevent ovarian cysts.
So what are the potential complications if an ovarian cyst is left untreated?
So if ovarian cysts are left untreated, the pain, because pain is one constant thing that comes with it when it is symptomatic, the pain could become so excruciating. The cyst can rupture. There can also be torsion. It can get twisted and even make the pain worse. There could be bleeding, especially in the case of endometriomas. And also, if it is infected, it can lead to a condition we know as pelvic inflammatory disease. And if it's a pathological kind of ovarian cyst, when not managed, it can cause infertility.
So can you tell us the difference between benign cysts and potentially cancerous ones?
Okay, benign and cancerous cysts are actually subclassifications of pathological ovarian cysts. So benign means non-cancerous. So when it's benign, it means that even though it's kind of serious, but it is not cancerous. It doesn't have any cancerous cell in it. It is not malignant. And usually on radiological imaging, the benign ovarian cysts are found to be simple, to be smooth, and also thin-walled, while the cancerous ones are usually rough, complex, solid, and irregular. All these are found during radiological investigations, which are necessary in diagnosing ovarian cysts.
Can hormonal birth control affect the likelihood of developing ovarian cysts?
Well, not really. Ovarian birth control pills or any other means have not been associated with the occurrence of ovarian cyst. However, they've been found useful in preventing recurrence of functional ovarian cyst. Like I mentioned earlier, birth control pills will inhibit ovulation, hence making those things that would cause ovarian cyst to develop also not to develop. So it is rather useful in preventing recurrence than it being a risk factor for developing it.
So what are the likelihood of a reoccurrence after an ovarian cyst has been treated? And what causes the reoccurrence?
So the risk of reoccurrence depends on the type, and it has been noted that recurrence can be as high as 10 to 20% depending on the type of ovarian cyst. And the causes of reoccurrence are not so well known, but if it is a functional one and it is associated with ovulation and menstrual processes, there is every likelihood that it can keep coming up each time the woman ovulates or at any point in time in the menstrual cycle. And if it is the pathological one, because it is an abnormal growth of cells, so at any point in time in the reproductive lifetime, the cells can just, go overboard and reproduce themselves again and, grow into something that is not wanted. So there is really no factor, especially that is responsible for recurrence.
So can diet or supplements play a role in managing ovarian cysts?
Okay, well, not so established. There are no researches yet that we can, lay odds on about diet and supplements being helpful in preventing recurrence. But like I mentioned earlier, healthy lifestyle is key in preventing occurrence of some medical conditions. So eating fresh fruit, eating vegetables, taking whole grains, basically eating balanced meal is going to be helpful in preventing the occurrence of ovarian cyst. Especially fruits and vegetables, they contain a lot of antioxidants that are necessary in killing or inhibiting the growth of all these abnormal cells. So I believe that if an individual makes it a lifestyle to eat a lot of fruits and vegetables, whole grains, basically healthy eating, is going to really help in preventing all this.
All right. So can ovarian cysts occur in pregnant women, and can it also cause complication during pregnancy period? That's if it can occur in pregnant women.
Of course, ovarian cyst can occur in pregnancy, and in this case, it is called a corpus luteal cyst. Most times when it occurs in pregnancy, it doesn't cause any problem, and both of them, both the pregnancy and the cyst, can coexist without any complications at all. However, it is very important to monitor such pregnancies very well, so that if complications arise, it will be picked early and managed as required. And if these complications eventually happen, it may affect the eventual outcome of the pregnancy.
So what follow-up care is recommended after treatment for ovarian cysts?
So for anyone that has had a case of ovarian cyst before, it is important that such persons go for routine and regular checkups with their doctors, especially gynecologists, who would periodically do a gynecologic examination on them and also have them do regular pelvic scan so as to detect if their ovarian cyst growing again. So if patients like this go for continuous and regular checks, whenever ovarian cysts are discovered, they would be managed as soon as possible before they become something so huge. So basically, it's periodic checks with the gynecologist and periodic pelvic examinations that is needed.
So how do ovarian cysts differ from other cysts in the body?
Okay, from the name, ovarian cyst are cysts on or inside the ovary. Cysts can occur anywhere in the body. as long as those organs are living. So if they occur in any other part of the body, they would be named in relation to the body part where they occur, while ovarian cyst is strictly around, in, or on the ovaries. That's the major difference.
Okay, so does ovarian cyst affect sexual health or one's libido?
Well, not really. Ovarian cyst doesn't really have anything to do with libido or sexual activity. But the only thing is that because pain is very common with ovarian cyst, if it's such excruciating, it can affect the wholesome being of the person, the excitement level, the emotional health, the total health of the person, and as such can impede on the satisfaction that such person is expected to get during sexual activities. You can't expect somebody that is going through serious pain to be so excited about sexual activity. So that is the part where it can come into play. But overall, libido does not have to, as in ovarian cyst doesn't have any direct effect on libido, except for the awesome life experience of the person that can be hindered.
So aside from surgery, is surgery always necessary for ovarian cysts? And what would you say are the risks and benefits of different surgical options for ovarian cysts?
Well, surgeries are not needed for all types. I already said earlier that only pathological or persistent cysts may need surgery. So when the cyst is functional, it resolves on its own. There is no need to do a surgical operation. Doing a surgical operation comes with its own attendant risk. So we want to be sure that a surgical procedure is actually necessary in that particular patient before the decision is made to make her undergo such. So most times we watch to see if the cyst will resolve on its own. And if it does, all the person needs to do is just to come for follow-up visit. When it's not, even when it does not resolve on its own, that is when they need to give analgesics as supportive treatment, and also the birth control pills come into play. So with the birth control pills, there might be no need to do surgery. But when the cysts are persistent, they are becoming more, they are making life unbearable, or it's already affecting the fertility, or it's even a pathological one like the dermoid cyst or the endometrioma, then there will be a need for surgery. But the risks and benefits have to be weighed very well before such decisions are eventually made.
So what are the signs that one see to know if ovarian cysts are cancerous? So what are these signs?
Okay, most times if the ovarian cysts are cancerous, they are picked on during investigations. There's, apart from the imaging like the ultrasound scan, we also have the CT scan that gives a more in-depth view of what the cells are or what the cyst is like. And there's also another test that is done, a blood test that shows if there are actually tumor markers in the cyst or not. So if that test is done, then and the diagnosis of cancer is made, then the necessary treatments, which will include chemotherapy as well, will be done. But if those blood tests are done and the test is negative for cancer cells, then it might just be the surgery alone that will be done. Most times when it is cancerous, there could be some other symptoms like loss of weight, like pain being so excruciating and even extending to the waist. There could be abdominal distension. There could also be bleeding, irregular bleeding, for a woman to bleed like almost every day during the month, or when the cycle can no longer be monitored, the bleeding is just coming, we call it dysfunctional uterine bleeding. So such can happen and can be a pointer to a cancerous ovarian cyst.
So what supports and resources are available for women dealing with these ovarian cysts? Because it's not everyone that has the financial stability to go through the process.
Well, to the best of my knowledge, I'm not sure if there's any support or advocacy for women with ovarian cysts. Maybe because it is actually not a serious condition, so to say. I said that the most cases of ovarian cysts are actually functional and they resolve on their own. So people might not even have to take any medications and they will just be fine. So because it is seen not as a very serious case, I guess that is why we do not have standard systems in place to alleviate the situations of people that have ovarian cysts. But I'm so sure that if eventually it is found out to be cancerous, there are organizations, there are NGOs, there are bodies that support women that have one form of cancer or the other. There are a number of them out there that can be, sought, and they would provide help, assist with management, assist with procedure, with the chemotherapy, give moral support, and even rehabilitation after all of the treatment is eventually completed.
So are there any long-term health consequences of one that has had ovarian cysts? Are there any long-term consequences?
Well, it's not so likely, except for anybody that has pathological one that has not been managed well. Part of the complications we mentioned was infertility for the pathological ones. So if the ovarian cyst is not well managed, it can actually make a woman to be infertile for the rest of her life. But if it has been established that that is the cause of the infertility, because there are a lot of causes of infertility, other causes have to be excluded. So provided other causes has been excluded and it is just that, maybe the dermosis, for instance, or the endometriosis, so such can lead to infertility, and we all know that that usually is a long-term effect. But for the other complications, they are most times short-term, and once they are managed, once the condition is managed, all other complications can get out of the way.
Okay. Well, public health practitioner Dr. Adejoke Adepoju, thank you for lending your thoughts on the program.
You're welcome. Thanks for having me.
And that's all we can take on this episode of the program. Till I see you next time. Bye for now.